Hello, guys. I'm really glad to be back here again and speaking to everybody. And I first wanted to start by personally thanking Steve and Denise Wilson for inviting me back to this venue for yet another year. And I kid you not, after speaking here, I always call them and say, please invite me back for another year. And so that worked last year, and hopefully I'll have the opportunity in the future to come back here to speak to everyone. I also wanted to thank Jan Duran as well for always supporting me. I've did some work recently with the American Heart Association, and Jan, Denise, and Steve really helped a lot in my work with the AHA. And I also, before I even start speaking, I really want to thank all you guys out there personally for always looking forward to having me back to speak. This is my most favorite venue to speak at, and I look forward to every year to come back and see you guys. So thank you so much. All right, and disclaimer, I did not coordinate this with the AHA at all. But yes, I'm very passionate about cardiac arrest survival and do a lot of work with that. And also today, I just gonna be talking about hypertension of other topics. Before I start, and you guys, if you're thinking about leaving the lecture because hypertension is such a boring topic for you, give me a chance. I promise that in the next 20 minutes, I'll try to make a very boring topic just as exciting as anything else, so stay tuned. All right, so the reason why I think it's so important for me to finally talk about hypertension in a venue like this is because hypertension is a disease condition that affects so many people. And if you can look at the age range of the adult Americans, you can see that all of us in the room, I know that all of us here, we're in our 30s and 40s at most, but once we get to where we're 80s, 70s, and 80s, almost all of us will actually start to develop hypertension as a disease condition. It's very, very common. And on top of that, you can see that this condition does not discriminate really in terms of race. It affects every race to the same significant amount. And yes, the Black American population do tend to have it a little bit worse, but you can see that it affects the white population to a very significant degree, the Hispanics, the Asians, etc. And in fact, if you look at the whole United States, you can see that right now as we speak, about 50% of all adults in the US actually have hypertension, high blood pressure. And of all these patients that actually have hypertension, you can see how many people there are that have hypertension. 80% of those patients actually are not being well treated based on the current recommendations that we have for treating their hypertension. And of those patients that have hypertension, that are lucky enough to have a doctor to start them on a treatment, we know that up to 80% of those patients actually fall off their treatment within 1 year. So medication non-compliance, perhaps they didn't get their refills, perhaps the medications cost us too much, etc. 80% of those patients actually fall out treatment in 1 year. And so you can see how, given such a significant amount of patients involved and how much there are out there that are not well treated, hypertension is the #1 preventable condition in terms of causing heart attacks, strokes, and cardiovascular death, #1. And we've done so many trials with hypertension. I mean, we've done trials decades and decades ago, and it showed that if you take a patient population and you load that patient population's blood pressure by only 10 millimeters of mercury, you would decrease their relative risk of cardiovascular events by more than 20%. So just 10 millimeters of mercury of blood pressure, and we reduce it would reduce their risk by more than 20%. And on top of that, if we reduce the risk of dying by more than 13%. So you can see how 10 millimeters of mercury doesn't seem like a whole lot. You walk around fine with it, you feel fine. But in your whole lifespan, your risk goes up a lot if you don't control it. And that's why hypertension is so important, and that's why I want to talk about it today. And it's so important that nowadays we actually recommend much tighter control of blood pressure. For a long time, we always recommended that as long as you keep your blood pressure less than 140 over 90, you're good. We leave you alone. However, nowadays, we actually are very much more strict in terms of blood pressure. And so we would like everyone out there to have a blood pressure that is less than 130 over 80. 130 over 80. So a very strict number. And we also identify certain patients out there that are at particularly higher risk when they have hypertension. And so these patients are whom we call resistant hypertension. Resistant hypertension are patients who cannot be controlled despite at least 3 different medications. So your cardiologist will start you on one, it doesn't work, start you on another one, it doesn't work, a third one, it doesn't work, you are resistant hypertension. Or we start you on a 4th one, it finally works, but you need 4 medications out there to actually control your blood pressure. And the reason why we want to identify these patients with resistant hypertension is that, number one, very, very common to find resistant hypertension. Up to 8 to 20% of patients out there who have hypertension actually are considered to be resistant. So there's a lot of us walking out there that require a lot of medication to control their blood pressure. And the reason why we want to identify these patients, not only because there's so many of them out there, but these patients are at particularly high risk for having problems. So anyone who has persistent hypertension has at least a 50% greater risk of developing heart attacks, strokes, and cardiovascular death compared to everyone else who have high blood pressure. So just keep in mind, tonight when you go home, look at your medication list and count the number of medications that you need for blood pressure control. If you need 3 medications, and if your blood pressure is consistently over 130 over 80, please give me a call. All right. And of course, we also have to make sure that you are truly resistant hypertension, because there's a lot of patients out there that fall into the category of pseudo-resistant. And so there's a lot of examples. For example, they don't take their blood pressure readings accurately. So we train patients how to actually measure the blood pressures at home. We actually look at your blood pressures at home more than the office. So if you are actually one of our patients in the office, when you come to the office, your blood pressure is usually 150 over 90 because you see me in my scrubs. And then you're so worried that I'm going to start you on a blood pressure medication. But then I said, don't worry, your blood pressure at home is fine. So you're going to be okay. So measure your blood pressure at home very carefully. Make sure that you are not one of those patients who have what's called white coat hypertension, where when they see the doctor, immediately they get really freaked out. But the irony is that I actually don't wear a white coat in the office. And so I don't know what that's all about. Also, make sure you take your medications regularly as directed. I had a patient, I kid you not, yesterday I saw the patient, and he's actually on 3 different medications, and his blood pressure is terrible. So he's actually resistant hypertension. And of course his wife brought him in because he obviously doesn't want to see a doctor. So he was sitting in front of me, and he told me that nowadays, every time he takes all his 3 medications, he gets dizzy and lightheaded. And after talking to him for quite a bit more time, I realized that he was actually never really compliant with his medication. So he would be prescribed one medication, he takes it off and on, he comes to see his doctor, the doctor thinks that it's not good enough. The doctor piles another medication on top of the last one, he takes it randomly, and then the doctor piles a 3rd one on. And then all of a sudden, because his wife is getting at him, he now decides that he's going to be taking his medications every day. And all of a sudden, 3 medications is too much for him. So he's not really resistant, he's just non-compliant. But now he's like so good because his wife's next to him. So I actually took him off some of his medications because I knew exactly what was going on with the guy. So that was a story from yesterday. So it's a very common issue, and we have to work through all this if we're going to treat you adequately for your blood pressure problem. And of course, people take non-steroids, etc., that also cause problems as well. Now, once we diagnose you with hypertension, we've got a laundry list of medications that we can use. And I purposely made the list so small you can't even see it because I don't want to give away trade secrets. The other cardiologists may be mad at me. But mainly that's just to show you all these different options that we have, all these different classes of blood pressure medications, all these different combos, and a responsible doctor will pick one that is just right for you based on your other conditions that you have. So it could be a pretty complex process in terms of determining what else you have that could favor one medication versus the other. Now, the problem is that, so if I take any patient and if I have free reign on just piling one medication after the other, I guarantee you I will control everybody's blood pressure. That's not a problem because I have so many things that I can use. The problem is that as we keep increasing the dose or as we keep piling on these medications, the patients will start to have side effects. The patients will start to have side effects. And I've been doing this for a long time to know that if my patient says he or she has a side effect, I believe him or her because all patients are different. So even if they have a side effect that is not known to be caused by that medication, I believe that person because I've learned my lesson through the years. So patients can have a lot of different side effects for medications. And I just wanted to illustrate